Adrian, the TGA has approved the Pfizer jab. What does it actually do?
Look, this is very good news. The Pfizer vaccine has already been approved by several other countries, including the EU, UK, Switzerland, Canada. So we're definitely not the first to give it full approval. But nonetheless, our TGA is renowned for being very strict when it comes to looking at drugs and vaccines. They're very, very thorough. And for the TGA to give it full approval means that they are convinced that it's safe and effective. And that should be a great reassurance to the population, the general population in Australia.
What are the safety risks for elderly and vulnerable people?
Look, we've seen some cases of frail elderly people dying in Norway, which hit the news. But the Norwegian regulating authorities have come out saying that it's not related to the vaccine. So I don't think it's a major issue. The thing about this mRNA vaccine is that it's a very strong vaccine, which is why it produces this brilliant 95% efficacy. But at the same time, because it's a strong vaccine, it also has some reactions when you inject it into someone. And so there's lots of people getting sort of headaches and mild fever and pain at the injection site. But these are just transient. They will pass. And so that's why the TGA think that it's going to be a very safe vaccine.
There's still a lot we don't know about the vaccine. What does it mean for pregnant people, for instance?
Well, we don't know because it wasn't trialled on pregnant women. So at this stage, we really haven't got a clue whether or not it will work successfully in pregnant women. So WHO have not approved it for pregnant women. And as we heard, the Australian government is allowing the clinicians to make that decision.
And so the vaccine can prevent people from becoming ill, but it doesn't necessarily mean that it will stop them from carrying the virus. Does this mean that hotel quarantine will stay around for a while?
Look, we don't know at this stage what percentage of infections it will stop. The CEO of BioNTech thinks that it might prevent 50% of infections, but that's his thoughts. We don't have the evidence. If you look at the Pfizer-BioNTech study protocol, which is the big list of exactly what they were doing in their phase 3 trial, one of their trial endpoints is prevention of transmission, but they haven't actually published that information. So at this stage, we don't know exactly how well it will stop transmission. And until that happens, we will still have to rely on social distancing and masks, etc. In terms of hotel quarantining, if someone has a history of vaccination and gets tested before departure and on arrival, then it's a pretty low risk and they might not need quarantine hotels.
What's the big challenge here for 2021 when some people will have received the jab and so many would still be waiting for it and some won't be getting it at all?
Well, there'll be very few people who won't get it. I mean, at the moment, none of the vaccines that we purchased have been trialled in young children, for example. So that's a sort of big gap in what we understand. Clearly, I mean, the first major problem is can we get our 10 million doses on time? And we've already heard that there are major supply issues. There are some countries in Europe that will be given half the doses that Pfizer promised because of production issues. So I think that's the first question here is can we get our 10 million doses in a reasonable time period? I don't think it's fair to blame the Prime Minister for timing. He has got no responsibility for Pfizer's production schedule. We get it when we get it. But we can manufacture the AstraZeneca vaccine ourselves. So there'll be no supply issues with that. And I think everyone in Australia who wants it and needs it will get it in good time.
Do you think Australia should be increasing our vaccine portfolio?
Well, we've already got 3 now because we've got Novavax as well, which is still in the middle of phase 3 trials. We've also got a subscription to COVAX, and that will give us access to vaccines like Moderna. We don't know the timing of that yet, but Moderna has also been approved around the world and has the same efficacy as the Pfizer-BioNTech vaccine. So I think we've got plenty of options available in Australia.
Adrian, Esterman, appreciate your time this morning.
Not a problem.